Senator Warner.
Hey, Ariel, how are you?
Good, how are you?
Well, it's finally the day.
I can't believe it. I saw that you called this bill a political albatross, and can you explain to my followers what that means?
Well, it means, do the American people really want to cut 16 million Americans off of health care, cut food assistance to 4 or 5 million Americans, including school lunches, food banks, basically eliminate our country's whole movement towards cleaner energy? And for what purpose at the end of the day? Well, to give a bigger tax break to the wealthiest Americans. I mean, there. I don't mind if people do well, make a lot of money, fine, but pay a fair share. But this is kind of like reverse Robin Hood. And at the end of the day, I kind of believe that the American people are better than that. At least I hope they are.
Absolutely. One thing that people are not thinking about is how these cuts are going to affect rural hospitals.
Rural hospitals already operate on very thin margins because you've got the insurance companies, you've got the cost of maintaining your hospital. Many rural hospitals, for example, have already shut down OBGYN services because it's too expensive. Well, if you in many rural communities, you've got upwards of 50% of the people on Medicaid. If those patients lose the Medicaid and don't have reimbursement, people are still going to show up. They still get sick, but they're going to show up at the emergency room, and the rural hospitals will have to eat those costs because it comes in as uncompensated care. You can't turn somebody away. And I think you'll see many rural hospitals have to close down or even further cut back services. And the two services that they'll cut back the most are OBGYN and mental health. And, should you have to drive 4 hours to have a baby, or what happens if you've got mental health needs in rural America and you can't get any services? It's awful. And, the amazing thing is President Trump won in most of rural America. He's really sticking it to the very people who supported him in the first place.
I was just thinking that, and it's just so awful because I do feel like this administration is just straight up lying to people.
I think you're right, and it's. I think we're finally starting to break through because good folks like you with your audiences are allowing us to kind of make the case, and I think it's been everybody's political attention span is so short these days. Last week it was the bombing in Iran, and the week before it was crazy stuff about immigration, and so the idea that this god awful bill, this lipstick on a pig they're trying to present, has been kind of bumping along until it gets now to the floor of the Senate, where people are going, holy heck, this really sucks. And my fear is that a lot of my Republican Senate friends, I think they know in their heart. I don't know if you followed, there was Senator from North Carolina, Tom Tillis, finally said yesterday, I can't put up with the bullshit anymore. I'm going to tell the truth. I'm going to vote against the bill. And even if, of course, he also said he's not going to run for re-election because Trump has so much control. But I do hope a few more of my Republican friends will do what they've talked to me about in private.
It does drive me bonkers, the whole lipstick on a pig thing, because people will point to like the one or two good things and be like, well, but it does this. And it's like, the harm is so much bigger than the good things in this bill.
Think about it this way, too. Obamacare was not perfect, but it dramatically lowered the percentage of the uninsured in our country. This bill will have the effect, and some of the Republican senators have either said, of wiping out all the gains that came from Obamacare. So we could go back to having not 6 or 7% of Americans uninsured, but 15, 16, 17%. I don't think anybody wants to go back to those days, but that's the effect of this bill.
Yeah, it's very sad. And before we go, I want to pivot kind of into education. I'm a former public school teacher, a lot of my audience is as well. And the Trump administration just forced out University of Virginia's president. This is the president of a public university because he would not kill DEI programs fast enough. What do you think?
I think it's freaking outrageous.
Yeah.
I used to be governor in Virginia. We have great public universities. We have a very strong governance system. The Board of Visitors does a great job. Jim Ryan was a great president at UVA. He was actually agreeing to cut out these programs. But what this Department of Justice did is they said, if you don't quit on that one particular day, we're going to cut hundreds of millions of dollars from the university. We're going to potentially put in jeopardy foreign students' visas. We're going to go ahead and have literally hundreds of researchers lose their jobs. And he did probably the right thing. I mean, I wish he would have fought a little more, but I think he would already said he was going to retire at the end of next year. But my God, what in the heck? I thought the Republicans were supposed to say, we don't want federal intervention. We want states and localities to, control their own education. Baloney. And this is, outrageous. And if you think it can only happen in Virginia, you're wrong. Every public university in the country is potentially on the chopping block if these kind of rulings and threats can stand.
Baloney is right.
I was actually going to say bullshit, but I don't know whether I should on you.
I've been calling it the big bullshit bill because it's really what it is.
You're right. I mean, like sometimes politicians always say, and I've been probably guilty of it too, oh my gosh, the wolf's at the door, the wolf's at the door, and then things don't happen. This time, the wolf's at the door. And kind of basic notions of whether it's academic freedom, whether it's maintaining the world's best research universities, whether it's the idea that healthcare, it's actually smarter to have poorer people in healthcare than go into the emergency room. That a kid ought to go to school not hungry, and school breakfasts and school lunches make sense. All of those things. This time it is for real, and my fear is not unlike in certain ways, maybe part of the Latino community who thought, oh my gosh, well, Trump's not going to be that bad, and then you see these ICE agents that are completely mass grabbing people off the street and deporting them without any due process. I just hope we don't have to go through that and have literally millions of Americans, particularly in rural communities, say, oh my God, my health care's gone. How did that happen?